Joanna Seeley, and today I'll be demonstrating the structures of the heart, of the sheep's heart. Here we have the apex. Over here on this side would be the left ventricle. Then a little bit above it, the great cardiac vein. The anterior intraventricular artery, a little bit more above it. And then you have up here in this area the left coronary artery. And as you go up, you have the auricle of the left atrium, the pulmonary trunk, the pericardium, the left pulmonary artery, and the aorta up here, the superior vena cava on this side. Over here is the auricle of the right atrium. And below that you have the right atrium, the right coronary artery below, the right ventricle artery and vein like this. Over here in this section you have the right ventricle of the heart, a little bit in this section, and again this is the apex of the heart. With a little bit more in depth of the heart, the right auricles collect deoxygenated blood and pushes it to the right ventricle. Left auricles collect oxygenated blood from the lungs and push towards the left ventricle. The aorta distributes oxygenated blood to all parts of the body through the systemic circulation. The ascending aorta, which starts from the left ventricle of the heart and extends to the aortic arch. The right and left coronary arteries are the right and left coronary arteries that supply the heart muscle arise from the ascending aorta. And then you have the aortic arch. It is a part of the aorta that begins at the upper border of the second sternocostal articulation of the right side and runs at first upward and backward and to the left in the front of the trachea. The brachiocephalic artery is a short artery that supplies oxygenated blood to the head. And to the neck and to the arm regions of the body. The left common artery is the biggest and the left common artery is the longest of the two common carotid arteries, arising from the aortic arch and having cervical and thoracic parts. The left subclavian divides into three parts, and it arises from the aortic arch to supply the vertebral column, spinal cord, the air, and the brain. Okay. Here are the the answers to the questions that were asked on the report. The superior vena cava, it brings blood from areas of the body located superior to the diaphragm. This is a superior vena cava and inferior vena cava vein that returns deoxygenated blood from the circulation in the body and empty into the right atrium. The inferior vena cava, it brings in blood from areas of the body located inferior to the diaphragm. The coronary sinus, it brings in blood from the blood vessels in the myocardium. The superior vena cava and the inferior vena cava vein that returns deoxygenated blood from the circulation in the body and empties into the right atrium and the coronary sinus is also a vein. Where is the blood in these vessels going? The coronary sinus is a collection of veins joined together to form a large vessel that collects blood from the heart muscle, the myocardium. It delivers deoxygenated blood to the right atrium, as do the superior and inferior vena cava. It is present in all mammals, including humans. The coronary sinus